Good morning, friends. Myself, Dr. George Michael. Any microorganism which can cause any skin conditions, severe itching, exudation, we call discharge from the skin level, redness, scaling, and long usage of other drugs. Especially, we call the patient with the diabetes mellitus and usage of the immunosuppressant drugs called prednisolone, betamethasone, and certain ketoconazole groups of ointments. Infants, poor hygienicity. Third thing is usage of the nylon on Tyrolean clothes, especially in the socks, which cause all the diseases we usually call by it's called protozoa. And it's become more infectivity, which also lead into other secondary infections. So majorly when you consider, there are three conditions are there. One thing called tinea, we commonly call ringworm. See, it can affect the 3-4 years. One thing is if it can affect the head, it called capitis. If it can affect the trunks, we call corporis cruris in the inguinal region. And generally, once it starts, it becomes long-standing process within the body. As long as you use anything external applications, which can only alter the appearance of the skin lesions, but the internal, all the microorganism activities remain for a long time. So one of the very challenging this condition, the condition called candidiasis. Especially it is seen in the even the most healthy people, because it can affect the oral cavity. We call the thrush. So it can cause in the angle of the mouth. So we call angular stomatitis. The appearance like curdy white appearance, maceration we call, severe itching, not able to eat, burning, those symptoms are there. These are commonly seen the people called who are suffering with the diabetes mellitus, using of the immunosuppressant drugs. Okay, even with the deficiency of vitamin B complexes. So these cause them. When you talk about the candidiasis, there are many conditions we come across that, like in the especially when you talk about the intertrigo, it's normally it affects the below the breast, so in between the femur webs it get affected, and the foot also sometimes noticed. In the urinary passages, especially in the females, ulovaginitis. In the males, in the reproductive area, that is called melanoprostatis. And even it can affect the nail bud, we call paranoia. So it damages the nail bud, it causes the discoloration and disintegration of the nails. So which once it starts, it remains for a long time. So now, what we talk about the solution part, how do you treat this? So according to our knowledge, according to our experience, what happened? Long usage of the anything external application which only can alter the appearance of the skin lesions, but the hyperactivity of the microorganisms we call protozoa, otherwise fungus, it remains inside the body. So by only option, by using suitable homeopathic medication, internal medications, if these medicines which can increase the immunoglobulin E, we call epsilon, that's one of the richest antibody which usually secreted by the lymphocytes and plasma cells. By giving homeopathic medications, we have to increase the immune system, we have to make a powerful immune system, and we can get rid of these fungal infections the rest of our life. So I'll come back to you one more effective subject. A wonderful time. Have a great day.